tetracyclic antibiotics. So in this the classification we have the tetracyclines and glycyclines. So in tetracyclines we have oxytetracycline, tetracycline, demeclocycline, doxycycline, minocycline, and in glycycline we have tigecycline. Tetracyclines, 4 cyclic rings. Mechanism of action, so 30 years ribosome. If you remember that mnemonic, what is that mnemonic? By at 30, cell at 50. What was the abbreviation for the AT? Was aminoglycosides and tetracyclines. So aminoglycosides and tetracyclines are 30 years ribosomal inhibitors. So if they're talking about ribosomal unit, what does ribosome do? Makes proteins. So if something is obstructing that ribosome, it is not able to make any protein, okay, which is essential for the life sustaining for the bacteria. So it is preventing the binding of the amino acyl tRNA and the to mRNA ribosome complex. Then there is no growing of the peptide chain. Done. So this was the mechanism of action. In terms of resistance, bacterial resistance to tetracycline is due to the decreased influx or increased efflux of the tetracyclines. So what does this bacteria do? They either do not take the tetracyclines inside them, or either they create certain kind of efflux pumps which will throw out these tetracycline molecules. Okay, and the second point is inactivation of the drugs by the enzymes, or else they can also induce or make certain kind of enzymes which will inactivate these drugs. What are the adverse effects? So we have GI symptoms, then phototoxicity, hepatotoxicity, renal toxicity, super infections, effects on the bone and teeth, vestibular toxicity, hypersensitivity reactions. So in GI systems, on oral administration, they can cause GI irritation manifested as nausea, vomiting, epigastric disease, abdominal discomfort, and diarrhea. Diarrhea is more common with tetracyclines and oxytetracyclines, as they are incompletely absorbed, cause alteration of the normal flora. So if there is alteration of the normal flora, there is one more kind of bacteria called as Clostridium difficile, which will take over the gut microflora, and it increases the risk of pseudomembranous colitis. Okay, risk of the diarrhea is low with the doxycycline. So if we do not give tetracycline, we can instead give the doxycycline. So in this, the risk of the diarrhea will be reduced. Then we have the phototoxicity. It is particularly seen with demeclocycline and doxycycline. So these both have tendency to cause photosensitivity. Then they may also produce sunburn like reactions in the skin on exposure to sunlight. They may also produce pigmentation of the nails. Okay, they cause hepatic necrosis along with the fatty changes. Is common in the patients receiving high dose, more than 2 grams per day intravenously. Pregnant moment, it is more likely to happen. What? The hepatic necrosis with fatty change. Then we have the renal toxicity. Demeclocycline may produce nephrogenic diabetes insipidus by blocking the action of the antidiuretic hormone. So this antidiuretic hormone is coming from where? Coming from the hypothalamus. So it causes the nephrogenic diabetes insipidus by blocking this hormone. Where? On the collecting duct. This effect of the demeclocycline has been used therapeutically in patients with syndrome of inappropriate secretion. So in SIDH, demeclocycline is used for this purpose. Okay, then we have the Fanconi syndrome. Let me just zoom in. Fanconi syndrome, this happens when the tetracycline is given when it is outdated, so may damage the proximal renal tubules. The patient may present with nausea, vomiting, polyuria, proteinuria, acidosis. They should not be used if their expiry date is over. Why just this? Nothing should be used, okay, when the expiry date is over. And then we have the super infections. It is common with older tetracyclines, okay, because of their incomplete absorption in the gut. So if they are not completely absorbed in the gut, they will cause the alteration of the gut flora. Then again, that Clostridium difficile and pseudomembranous colitis. Okay, then on the effects on the bone and teeth. So tetracyclines, they special, this is most important one. This the tetracyclines, they cause chelation or they have the chelating property with the calcium. They bind to the calcium and form tetracycline calcium orthophosphate complex, and this complex they tend to deposit on the growing bone and even teeth. Use of tetracyclines in children and during pregnancy can cause permanent brownish discoloration of the deciduous teeth. Due to the deposition of the chelate in the teeth, there is increased incidence of the caries in the teeth. Tetracycline also affect the linear growth of the bones. So at the end, see, if there is some disturbances while deposition of the calcium when the child is growing, so this calcium is being bound with this tetracycline, so they are unable to utilize the calcium properly, hence there is decreased in the linear growth. The incidence of the hepatotoxicity is more in pregnant women, that is already mentioned somewhere here. Therefore tetracyclines are contraindicated during pregnancy. Done. It is also contraindicated in children up to 8 years because they are growing in that particular stage, right? Then we have the vestibular toxicity. So nystagmus and vertigo can occur in the with minocycline. They may cause increased intracranial pressure, okay, pseudotumor cerebri, and hypersensitivity reaction, skin rash, fever, urticaria. That basically caused by everything. So let's just quickly revise. So what do we have? Adverse effects: GI adverse effects, diarrhea, alteration of normal flora, risk of the diarrhea is less with the doxycycline. Phototoxicity, then hepatotoxicity with necrosis and with fatty changes, and it should not be given to the pregnant women because it causes more. Renal toxicity, nephrogenic diabetes insipidus, demeclocycline can be given for the SIADH because it blocks the antidiuretic hormone on the collecting duct. Then we have the Fanconi syndrome, which is because of the outdated tetracyclines. Okay, well, it will cause nausea, vomiting, polyuria, proteinuria, and acidosis, etc. Super infection, Clostridium difficile, again because of the alteration of the gut flora. Then all this also there, Candida, Proteus, pseudomembranous. Effect on the bones and teeth because of the calcium chelating property and formation of the complex cycline calcium orthophosphate complex deposits on the growing bone and teeth. Tetracycline also affect the linear growth. Should not be given in the children under the age of 8. Vestibular toxicity, nystagmus, vertigo, etc. This occurs with the minocycline. They can also increase the intracranial pressure, that is called as pseudotumor cerebri in infants. Then we have the hypersensitive reaction, skin rashes, fever, urticaria, exfoliative dermatitis, etc. Then we have the therapeutic uses. In therapeutic uses, we have the rickets cell infection, mycoplasma pneumonia infections, chlamydial infections, cholera, brucellosis, plague, and acne. Also given in the leptospirosis. So in rickets cell infection, tetracyclines are the first choice of drugs. Okay, so how do we remember this? Rickettsia, double T, tetra, double T, okay, whatever. So rickets cell infections, tetracyclines are the first choice of drugs for the treatment of the rickets cell infection. Example, we have the epidemic typhus, Rocky Mountain spotted fever, scrub typhus, rickets cell pox, and the Q fever. Doxycycline 100 mg twice a day is given orally or intravenously for 5 to 7 days. Then we have the mycoplasma pneumonia infections. Doxycycline has good activity against mycoplasma, used to shorten the duration of the illness. It is the first choice of drug in atypical pneumonia due to mycoplasma pneumonia. So doxycycline has good activity in mycoplasma pneumonia. Then we have the chlamydial infections, in which we have the lymphogranuloma venereum. Then we have the chlamydial urethritis and psittacosis. So it is sexually transmitted infection caused by C. trachomatis. Doxycycline is the drug of choice. In complicated cases, that is in pelvic inflammatory diseases, doxycycline 100 mg twice a day should be continued for 21 days. Macrolides are also effective. So in lymphogranuloma venereum, you give doxycycline and the rest of the information. Then we have the chlamydial urethritis and granuloma inguinale. So here also again doxycycline. Psittacosis, doxycycline. Okay, then we have the cholera. Fluid and electrolytic replacement is the mainstay of the treatment. Single dose of tetracycline 2 g or doxycycline of 300 mg can be effective in adults. It reduces the stool volume. Done. Then we have the brucellosis. Treatment of the choice is a combination of the doxycycline with rifampin. We have already studied this rifampin in the antitubercular drugs, right? So for the brucellosis, treatment of the choice is a combination of the doxycycline with rifampin or gentamicin or streptomycin. All these are aminoglycosides. Rifampin is first line of the antitubercular drug. Then we have the plague. Doxycycline is highly effective. So all these things is managed by the doxycycline. So somehow doxycycline is much better than the tetracyclines, okay, advanced one. So as an alternative drug for the treatment of the leptospirosis, doxycycline is an alternative to penicillin. Then pneumonia due to chlamydial, all these things. Acne, low dose of tetracycline are used for the acne. So quickly, therapeutic uses: rickets cell infection, mycoplasma pneumonia, chlamydial infection, under which we have the lymphogranuloma venerum, chlamydial urethritis, reticosis, cholera, brucellosis, plague, leptospirosis, and acne. Also the malaria. So in malaria, doxycycline is used along with other anti-malarial agents, like in case of chloroquine resistant Plasmodium falciparum malaria, it is used along with for the chemoprophylaxis of the malaria. Okay. Then we have the amoebiasis. Then SIADH, demeclocycline, has we have already studied. SIDH. Leprosy. It is one of the component of the Rome. What is Rome? Rifampin, ofloxacin, and minocycline. So here we have the minocycline, which is tetracycline. Ofloxacin is a fluoroquinolones, and the rifampin we have the antitubercular drug for the single lesion paucibacillary leprosy. So this is less dangerous one. Filariasis, doxycycline is given orally in filarial infections. Okay, so all these slides we studied about the doxycycline. Like most of the time they are talking about doxycycline. So how important it is. So what are the advantages of the doxycycline over the tetracycline? The first thing is it can be administered orally and as well as intravenously. Okay, it is highly potent. It is completely absorbed from the oral administration, not like tetracycline, which was not completely absorbed, hence there was pseudomembranous colitis and everything. Then where the food does not interfere with its absorption, it has longer duration of the action, which is 24 hours is its half-life, requires less frequent dosing, incidence of the diarrhea is rare, and it does not affect the intestinal flora, unlike tetracycline. It can be safely given to the patients with renal failure. Okay, this is also one of the main reasons. If the patient has renal problems, then we cannot give tetracycline. Instead, we will be giving doxycycline, as it is excreted primarily in the bile. So that was about the tetracycline.